And Anne, I'll go ahead and turn it over to your team.
Thank you, Allie. Good afternoon, everyone. Thank you so much for joining us on this sunny day today. And again, thank you, Allie, for inviting us to share today. My name is Anne McCafferty. I serve as the program director for the Indiana Healthy Families Alliance, or IHFA, a program of the Indiana Rural Health Association. The IHFA's primary goal is to identify uninsured children eligible for Medicaid and CHIP, or the Children's Health Insurance Program. IHFA focuses on helping individuals and families across Indiana understand their health coverage options and, if eligible, enroll into Medicaid and CHIP. And you'll learn a little bit more about IHFA as we move along. Today's session is called Medicaid and CHIP Basics, What Families Need to Know. And our goal is to walk through the key information in a way that's simple, practical, and easy to understand. I'm joined today by Bryce Wray-Nelson, our program coordinator, who will be helping guide us through the content and share more detailed information about eligibility coverage and how families can apply. So before we get started, I just want to take a moment to share what you can expect to take away from today's session. By the end of our time together, our goal is that you feel more confident understanding the basics of Medicaid and CHIP here in Indiana. Specifically, we'll walk through the difference between Medicaid and CHIP, who may qualify for coverage, and what types of services are covered. We'll also spend time talking through how families can apply for coverage, and just as importantly, how to stay covered once they're enrolled. And finally, we'll highlight how IHFA health insurance navigators can support families every step of the way. Our overall learning objective is really to make this process feel less confusing and more manageable, so you feel better equipped to help the families you serve or even your own family access and maintain health coverage. Before we dive in, I want to quickly share how we're going to walk through our topic today. Instead of just taking you through slides, we're going to use a Q&A style format. We found this works really well because it lets us focus on questions we hear most from families. We'll also make sure to leave time at the end for your questions, and we encourage you to ask questions because we definitely want to hear from you. So, Bryce, to kick it off, and since our presentation is entitled Medicaid and CHIP Basics, can you break down for me and our audience exactly what Medicaid is?
Absolutely. So Medicaid began in 1965 when the United States government passed a law called the Social Security Amendments. This program was created to help people with low incomes get health care that otherwise they couldn't afford. Indiana Medicaid is funded by both the federal government and the state, as every state helps to run its own Medicaid program. When it first started, Medicaid mainly helped children's, families with lower incomes, older adults, and people with disabilities. And so over time, the program has grown to help millions of Americans get doctor visits, hospital care, and other important health services. Indiana Medicaid actually consists of several different programs, each serving a different population. And we've highlighted a few of those programs on this slide. So we have Hoosier HealthWise, which is for children and pregnant women. The Healthy Indiana Plan, or HIP, that's for low-income adults ages 19 to 64. Hoosier Care Connect for individuals who are aged, blind, and disabled. Indiana Pathways for Aging for adults age 60 and older who need long-term services and support. Traditional Medicaid fee-for-service, and that's for members who receive services outside of managed care plans or health plans like Anthem, MHS, CareSource, and United Health. And then we have MedWorks, and that's for individuals with disabilities who are working.
Great. And I guess, Bryce, the next obvious question is, what is CHIP?
That does seem like the next obvious question, doesn't it, Ann? So CHIP stands for the Children's Health Insurance Program. So this was originally created in 1997 when the United States government passed a law called the Balanced Budget Act. And this program was designed to help children and families who earn too much money to qualify for Medicaid, but still couldn't afford private health insurance. And like Medicaid, CHIP is funded by both the federal government and the states, and each state runs its own program.
Okay, so to make sure I have this right, And kind of to break it down for the audience, Medicaid and CHIP are both programs that help families get health insurance, but they serve slightly different groups. Medicaid provides health coverage for people with lower incomes, including children, pregnant women, adults, older adults, and people with disabilities. And then CHIP, which stands for the Children's Health Insurance Program, provides coverage for children and families who earn too much to qualify for Medicaid, but still need help paying for health insurance. So both programs help children and families get important healthcare services. And since our focus is on families today, what are the most common Indiana Medicaid programs for families?
Mhm. So since there are several Indiana Medicaid programs, let's go ahead and narrow down the list and look at two programs specifically. That's going to be Hoosier Healthwise for pregnant women and children, and the Healthy Indiana Plan, or HIP, for non-disabled adults ages 19 to 64.
Okay, can we start with HIP? Can you tell me what HIP is and who
Yes.
qualifies for HIP?
Yes, we can absolutely do that. So, the Healthy Indiana Plan, or HIP, is Indiana's Medicaid program, and this provides health coverage for low-income adults ages 19 to 64 who don't qualify for any other Medicaid program. And to be eligible, a person must also live in Indiana, be a U.S. citizen or a qualified immigrant, and meet the program's income requirements. And so I mentioned income as an eligibility requirement. And like all Medicaid programs, HIP has an income eligibility requirement, which means a person's household income must fall within certain limits based on their family size in order to qualify for coverage. And the income guidelines for HIP were actually just updated on March 1st and are included in this chart.
So HIP is for Indiana residents ages 19 to 64 who don't qualify for another Medicaid program and who meet those other eligibility requirements like income that you just outlined. So focusing again on families, does HIP include pregnant women as well, or is there a different program for them?
Yeah, that's a great question. So there are actually three Medicaid programs for Indiana's pregnant women. And so those are Hoosier Healthwise Package A, HIP Maternity, and Package B, Emergency Services Only with Pregnancy Coverage. And so let's go ahead and take a look at the eligibility requirements for those programs in the next slides. So with Hoosier Healthwise Package A, this provides full Medicaid coverage for pregnant women who meet specific requirements, such as you being pregnant, a resident of Indiana, being a citizen or qualified immigrant, and falling within the proper income guidelines. HIP Maternity provides pregnancy-related coverage for women who are enrolled in the Healthy Indiana Plan when they become pregnant. They must be a pregnant resident of Indiana, ages 19 to 64, currently enrolled in HIP. They have to be a citizen or qualified immigrant and also have that income requirement as well. And then the package B, emergency services only with pregnancy coverage. This covers prenatal and postpartum services in addition to the emergency services for pregnant women who meet the eligibility standards. They must be a pregnant resident of Indiana, a lawful permanent resident, and then be eligible for package E. And so I think it's important to explain that emergency services only, also known as ESO, with pregnancy coverage, is a type of Indiana Medicaid that helps certain immigrants who have lawful permanent resident status, but do not qualify for Hoosier Healthwise or HIP Maternity yet. This coverage can pay for prenatal care while the mother's pregnant and services during labor and delivery, and even care after the baby is born for a short time. It also covers emergency medical services just in case they're needed.
So we saw those income guidelines for HIP. Are the
Mhm.
income guidelines the same for pregnant women applying to enroll in Hoosier Healthwise HIP or the package B?
So the income guidelines for pregnant women were also recently updated on March 1st. So that's great for this presentation. And on the chart, you can see that the income guidelines are definitely more generous when compared to a household of two for HIP. Of importance is that a pregnant woman's household will count as two household members for eligibility purposes. And so, for example, if a woman is single and pregnant, her family size would actually be two, not one, because her unborn baby is being counted as part of her household.
Got it. Okay. So, and if a pregnant woman is eligible for one of these programs, what kind of healthcare services are covered during pregnancy specifically?
Yeah, that's a great question. So, this slide highlights some of the key services available to pregnant women who are enrolled in the programs that we just covered. While these programs cover many healthcare services, I'm just going to focus on some of the most important ones related to pregnancy and overall health. So, these include doctor visits for routine and prenatal care, hospital services for labor and delivery, prescription medications that may be needed during pregnancy. Mental health services are also available, which is very important because emotional health is a key part of a healthy pregnancy. And then, in addition, these programs provide coverage for pregnancy and postpartum care to help support the health of mothers both before and after birth.
Okay, so we've talked a lot up to this point already. We've talked about Medicaid coverage for adults ages 19 to 64 through the HIP program or Healthy Indiana Plan, and Indiana Medicaid programs available for pregnant women. Focus on the family. What about children? What Indiana Medicaid programs help make sure children have access to the healthcare services they need?
So, Hoosier Healthwise is the Indiana Medicaid program that provides health coverage for children ages 0 to 18. There are two main coverage levels based on family income. So, Package A provides full Medicaid coverage for children and families with lower household incomes. There are no monthly premiums, no copays, or cost sharing for those covered services. Now, Package C is part of the Children's Health Insurance Program, or CHIP, and it helps families who earn a little bit too much to qualify for traditional Medicaid, but they still need affordable coverage for their children. And so while Package C may require a small monthly premium, it still provides the same comprehensive health coverage as Package A does.
That sounds great. So Hoosier Healthwise, make sure I get this right. So Hoosier Healthwise Package A is for families with lower incomes, and then Package C is for families with higher incomes. Do they both offer comprehensive coverage?
Yes, they do.
And are there other eligibility requirements apart from income?
Yeah, so apart from income, the other eligibility guidelines are residency, age, and for Package C eligible children, they cannot be enrolled in another insurance plan, such as a parent's employer-sponsored coverage.
Got it. So I know you said Package C is available for families with higher incomes. Can you show me the income guidelines for Package A and Package C for Hoosier Healthwise?
Yeah, absolutely. So on this slide, you're going to see the income guidelines that were also updated on March 1st. You can see that the income standard for children, especially Package C, is far more generous for a household of four at $7,012.50 when comparing it to HIP's income guidelines for a family of four at $3,795. And so, what this basically means for families is that even though the adults in the household may not qualify for HIP, their children still may qualify for no cost package A or low cost package C, Hoosier Healthwise.
And I'm really glad you showed us this and pointed that out because I know that we at IHFA hear a lot from families that
Mhm.
assume that but because they, as the adult parent or caretaker, don't qualify for an Indiana Medicaid program for themselves, their children won't either. So thank you for showing that and explaining those income standards. They are quite a bit more generous. Now that we understand who may qualify, can you explain what Hoosier Healthwise covers once a child is enrolled?
Yeah, definitely. So, Hoosier HealthWise provides comprehensive health coverage to help children stay healthy and receive care when they need it. Children that are enrolled in Hoosier HealthWise can see a primary care doctor for regular checkups, for preventive care, including well child visits and recommended vaccines. The program also covers dental care, vision exams, classes, prescription medications, and visits with medical specialists if that's needed. And if a child needs additional care, Hoosier HealthWise also covers hospital services, emergency care, lab tests, and important therapies like physical, occupational, and speech therapy. It also includes mental and behavioral health services. And so together, these services help ensure that children can receive the care that they need to stay healthy.
Great. So we've talked about non-disabled 19 to 64-year-old adults who don't qualify for another Medicaid program could possibly enroll into HIP. And then the three programs for pregnant women, we discussed that. And now we know about Package A and Package C of Hoosier HealthWise and the services that they all cover. Um, Now that we kind of understand who may be eligible and what benefits are available, I guess the next important question is how can families apply?
Yeah. So, and as we mentioned earlier, Indiana Medicaid includes several different programs, but the good news is the application process is going to be simple because there's just one application for all these programs. Families don't need to go through the hassle of figuring out which program they qualify for before applying. Instead, they can submit one application, and the Family and Social Services Administration, or FSSA, will review that information and determine both eligibility and which program the applicant qualifies for. So, there are several ways that families can apply online through the FSSA benefits portal, by requesting and mailing a paper application, by visiting a local Division of Family Resources office, or by working with an IHFA navigator who can provide free one-on-one application assistance. And so, I think it's important to recognize that there is certain information that families will need to provide in order for them to apply and this be reviewed. So we need the dates of birth for all household members that are applying, the Social Security numbers, if available, for all household members that are applying, proof of income, current address and contact information, birth certificates for all the members that are applying in the household, immigration documents for all household members applying, and identification, some form of identification for all adult household members applying.
Okay, so once a family has applied, how will they know if their application has been approved?
Yeah, so after a family submits their application to FSSA, they review that information and then determine if they qualify for coverage. So once that review is complete, the family will actually receive a notice explaining whether they were approved, when their coverage will begin, and which Medicaid program or healthcare plan they're going to be enrolled in. So that notice may include any next steps the family needs to take, like selecting a healthcare plan or providing additional information if that's needed.
Great. So family gets the great news, they've been approved. Are there steps they should take after they receive that approval notice?
Yes. So once a family's approved for Hoosier HealthWise or the Healthy Indiana plan, there are a few important steps to help them start their coverage. Families should choose or confirm their healthcare plan and select a primary care provider who's going to help coordinate that family's care. They should then watch for their member ID card in the mail and schedule any preventive or routine healthcare visits. It's also very helpful to create a member account or download their health plan's mobile app to manage benefits and find providers. And then finally, families should keep their contact information updated with FSSA and use the benefits portal to report any member changes.
Great. So we know how they can apply, what to expect after they apply, and then those important steps they take once their application is approved. What about after they've been enrolled? Are there steps that members should take or information they should know to ensure that they keep their coverage?
So once somebody's approved for HIP or Hoosier HealthWise, it is very important for them to keep their information up to date so their coverage continues without interruption. Members definitely need to report any changes in income, household size, or address to the FSSA since those changes can affect eligibility. It's also important to watch for letters or notices from the FSSA as they can include important updates or requests for information. And then finally, members should complete their renewal paperwork when it's required to make sure their coverage continues.
And I'm glad you mentioned renewals. We covered renewals during our Lunch and Learn last month. And if any of you with us missed it, I encourage you to go back and watch it. And then, Allie, if you don't mind, if you could put the link to that video in chat, that would be great. But anyway, during that discussion, we talked about challenges that families may face in completing their renewal. Bryce, are there specific challenges that you see for families who are applying for Medicaid?
Yes. So, many families face challenges when trying to apply for or keep Medicaid coverage. The rules can sometimes feel really confusing, especially when families are trying to understand what their income limits are, what the eligibility requirements are, or even different program options. So the application process can also feel overwhelming because it may require forms, documents, and deadlines. In addition, notices sent by the FSSA can be misunderstood or overlooked, which may lead to missteps or delays. And some families simply don't realize that help is available to guide them through the process and answer all of their questions.
Well, I think you just gave us a great segue to talk about the Indiana Healthy Families Alliance. Can you tell me a bit about the services that IHFA provides for Indiana families?
Absolutely. I tell you what, with IHFA, we've got such a great team, and it's just an honor to be able to work with you all and do this great work throughout the state. I think it's important that families know they don't have to go through this process alone. The Indiana Healthy Families Alliance has trained navigators across the state who work with families one-on-one to help them understand their coverage options. We help families complete applications, gather the documents they need, and walk them through the process step by step. And if somebody already has coverage, then we can also help with renewals or help them understand letters that they receive from the FSSA. Ultimately, our goal is to remove the confusion and make the process easier so families can focus on getting and keeping the healthcare coverage that they need.
Well, thank you, Bryce, for walking us through this. You covered a lot of information and broke it down in a way that was really easy to understand. So thank you.
Mhm.
As we wrap up before questions, I want to quickly emphasize how important partnerships are to the work of Indiana Healthy Families Alliance. I think, as Bryce mentioned, what's important for families to know is that they don't have to go through the process alone. IHFA works closely with our partners, who include healthcare providers, community organizations, schools, and just, local coalitions across Indiana to connect families with our services. And by working in partnership, we really can reach more families and reduce that confusion around the enrollment and application process. And most importantly, make sure eligible Hoosiers are able to access and maintain the health coverage they need. So we've worked really hard to make connecting with an IHFA navigator super easy. We've put up a QR code that's shareable. Feel free to share this. That will allow individuals to go online any time of day and find an appointment that works for their schedule. If anybody has additional questions, they want to speak to us before they make that appointment, they're welcome to do so. Our phone number's up there. And then they can also email us at navigator@indianarha.org. And if you want to just check out more general information about our services, our website is included. I want to talk a little bit more about partnerships and collaboration and what that looks like. If you or your organization is interested, here's some of the ways we can support you. We've created a really easy referral pathway for families seeking free and unbiased health insurance assistance. I want to kind of back up on that word unbiased for just a minute. I have been asked, like, what's that mean, unbiased assistance? What that means is that we sit down with individuals and explain their options and the programs that they're eligible for. Unlike an agent or a broker, we don't have a stake in the game. We don't work for commission. We're completely fully funded by the CM for Center for Medicaid and Medicare Services, or CMS. So our services are always complimentary. We also offer educational presentations such as staff trainings, community classes, and lunch and learns like this one. And then we do participate in outreach events and set up resource tables. So if your organization has an outreach event that you think we'd be a good fit for, we'd love to hear from you. And then if you're just your staff or your clients just need overall Medicaid education, we're happy to provide that as well. And then we really work to customize our support based on those organizational needs. Just one last plug. We do have another Lunch and Learn coming up on April 29th, entitled Medicaid Coverage for Pregnant Women, Timing Matters. And we'll be joined again by Bryce and then our program coordinator, April Cash, our expert in all things pregnancy Medicaid. So we hope you can join us for that. So I'd like to go ahead and open it up for questions. I'm going to stop sharing my screen so I can look at the chat here.
Yeah, and I would say I'm happy to moderate those for you,
yeah,
Anne. So your
thank you,
team
Allie. Thank you.
you got a couple that came in. I'll give them to you in order that they came in. So what is the difference between HIP and HIP plus?
Oh, that's a good question. So it's a little confusing too because the landscape looks a little bit different. At one time, members were required to pay what they call a power account contribution. That contribution was anywhere from $1 to $20 based on where they fell in the federal poverty level or income standard. That power account contribution requirement has been suspended for the time being based on some legislative changes. So to answer your question specifically, when a member paid that power account contribution, their basic default HIP upgraded to HIP Plus. HIP Plus covers dental and vision services and some chiropractic coverage, I believe. So now HIP Plus is kind of the default coverage since we don't have that power account contribution requirement anymore. So you will hear occasionally HIP Basic versus HIP Plus, but HIP Plus is the one that covers dental and vision and is the preferred plan.
Bryce, you talked about when a woman becomes pregnant having two people. If there are twins, does each fetus count as an additional person?
Yes.
Yes.
Yeah, that's a good question.
I love the single question. I especially care about the twins question.
Yes, yes. It's a good question though, right? Because it's a question of, well, is it just one pregnancy or is it considered two in that? So they both count for the household number.
And yep, and that's actually a question on that application. And Bryce mentioned that is a kind of a blanket application. The FSSA will decide which program that person's eligible for. But on that application, it does ask, are you pregnant? And if so, how many babies are you expecting?
Perfect. One person asked, could you show a chart with more family members, at least up to 8? That would be helpful. I'm certain you don't have a chart handy right this second, but I'm certain we could get them to anybody that would like to drop their email in the chat. We can collect that.
Yes, and also if you go to indy.gov and Medicaid programs, there's a breakdown of the income charts that we showed you today. And I think there's like a formula that says for families above 5 add $423 to the income level. So that's probably the best place to direct the audience to, would be to check that out at indy.gov.
Thank you. In regards to a PCP, is this a network group of providers, or could this be any Indiana licensed providers?
Yeah, so Medicaid programs, many of them are managed by a health plan. You'll sometimes hear that called managed care entities, like Anthem or CareSource or MHS. Those are the three specific health plans right now for HIP and Hoosier Healthwise. They are network based, so you do want to check your options and check with your PCP if you have one that you'd like to remain with, to make sure that they accept, for instance, Anthem HIP or Anthem Hoosier Healthwise.
Okay, final question. If someone wants the Indiana Healthy Families Alliance to get out to one of their community events, do you go everywhere, or are there only certain locations? And who do we need to get in contact with if they want you to come?
Yep. So our program, the only boundaries we have are that we remain in the state. So yes, we can go anywhere. So if you have an event that you would like us to join you for, just shoot me an email. You can email at that navigator at indianarha.org email, and we'll take a look at that. And if our schedules permit, we'll certainly join you.
Okay. If anybody else has a question they'd like to ask, now is the time. Again, use the chat or Q&A function, or use the raise hand button, and we will allow you to ask your question verbally. Finally, while we wait for any more questions, we've got one more 2-question poll here for you. Should take you about 20 seconds max. If you could fill that out for us, very, very helpful in our ability to provide these educational offerings at no cost. While we wait for questions, and I leave the poll open for just a second here, I think we'll go ahead and end the recording for today. We do appreciate everybody's time, and Bryce, especially your time in providing this very informative session for us.